All right, coming up, it's a very common dental disorder that affects millions of Americans. We'll have details from the experts. It's estimated more than 10 million Americans are affected by a dental disorder called temporomandibular. It can cause pain in your gums, jaw, ear, and even your neck.
Yeah, that's right. But there are ways to improve and stop the symptoms. Joining us now to tell us more about it is Dr. Louis Orsatti and his wife, Debbie Orsatti. Good morning to you both. Thanks for coming back.
Good morning.
Thank you.
Great to see you.
Thanks for having us back.
It's a difficult disorder to say. I'm glad Sharon had to say it.
Yeah.
But it affects 10 million people. So tell us a bit about it and how you would know if you had a problem.
Well, it's a disorder that affects the jaw joint. And of course, everybody's got the joint that eat, talk, it's always moving. And sometimes the pain from clenching, from grinding, from daily stress, a number of things can bring it on. And you get this pain in this big muscle here into the joint and into the temporal area and the muscle here, and sometimes down into the neck. And it's quite disturbing. Stops you from eating properly, it just ruins your day. You're just uncomfortable with pain, constant pain.
So if you grind your teeth at night, that could be a possible cause?
That's one of the things, grinding the teeth, the stress from daily life. Misalignment of the teeth is another thing that brings it on. Several things that bring it on. Sometimes even sleep apnea can bring it on. But there's a lot of things, and it's just a miserable symptom to have.
I read that Botox is one form of treatment. Is that even
That was
effective?
one of the treatments I had. I actually have TMJ, and so I was having to have Botox treatments. I have TMJ more on this side, all along here, and I said no more. The Botox lasts about 4 months, and then it's back to getting injections again, and I said no more.
The amount that you would need for that muscle particular, because it's a bigger muscle, the cost goes up in the Botox. So it does work, but traditional treatments have been the splint, the night mouthpiece that's worn basically at night. It does alleviate some of the symptoms, but not completely. And it's hard to wear during the day. It's hard to eat with. So this newer company has come up with the TMJ Next Generation device.
Okay.
Small little inserts. There's one on the screen right there that goes into the ear. Now what it does, since the joint is right there by the ear, it provides a cushion, a support for the joint, and gives you that little constant reminder that, hey, don't squeeze down, because then it feels the pressure. Now they're little hollow tubes. Now they're not, you can hear it through them just fine, but they're little hollow tubes that fit inside the ear and they're comfortable. They don't feel any pressure or anything, but if you try to squeeze down, there's a little constant reminder, hey, this doesn't feel right. And so you kind of tend to back off on the pressure.
Right.
You can wear them anytime? I mean,
Anytime.
I wear them 24 hours, actually, yeah. I have them on right now, and you really can't even see them.
Can't see them at all.
See them
Looking right in your ear, you can't see it.
But it has given me so much more relief. I mean, I used to have the pain from here. I couldn't even turn my neck, and it would even come down my shoulder in the back. But since then, I mean, I'm not 100%, but I bet you I'm about 90% there. So I just think it is just the best thing. And I didn't want to try them, did I?
Yeah, we were kind of skeptical, but because she's tried everything. But it's at least as effective as the bite splint, as the Botox, but it's constant. It's day and night. You can eat with them on, you can keep them on during the day. Where the traditional bite splint, you can't have them on during the day. Okay, it's hard to talk, it's hard to eat. You know, you just can't do it. So.
And we also do have a giveaway. I wanted to reach down and grab the box. We do have a giveaway for this Saturday morning, but you've got to be in it to win it. You've got to call our number at 210-946-4372, and you can win this brand new Sonicare electric toothbrush. Guys, this is top of the line,
It
right?
is, it is. It's the #1 out there.
Only for your
#1.
guess.
And how long does this usually last? Will it last for the long haul? Because it is a bit pricey.
Yes, it does. It does. It's a very good, well built. It does last a long time.
Good stuff. Good information.
Free
Thank
for
you
your
guys.
viewers.
Yeah.
You bet.
Thank you for joining us.